Working in the healthcare industry can be both physically and emotionally demanding. While all healthcare workers are exposed to occupational stress, nurses report having the highest level of job stress among all healthcare personnel. Their role of patient advocate and primary caregiver puts the nurse in the difficult position of balancing the needs of the patient, the patient's various physicians, and other caregivers, including technicians and unlicensed personnel. Nurses are exposed to stresses related to their job function, available resources, and working environment.
Job stress is defined by the National Institute for Occupational Safety and Health as the harmful physical and emotional responses that occur when the requirements of the job do not match the capabilities, resources, or needs of the worker. Manifestations of job stress can include psychological distress, physical complaints, absenteeism, and job dissatisfaction. This can lead to higher rates of early retirement, sick leave, and use of antidepressants. Stress can also negatively impact work performance and affect the care given to patients.
Stress triggers the fight or flight response of the sympathetic nervous system, which causes an increase in blood pressure, heart rate, and blood sugar levels. When these changes do not occur often, it poses little risk to one's health. However, with repeated response, a wide variety of acute and chronic health conditions may develop.
Common early signs of work stress may include headaches, upset stomach, mood and sleep disturbances, and disrupted familial relationships. Persistent exposure to work stress has been associated with high blood pressure and cholesterol levels, anxiety and depression, cardiovascular disease, infectious and autoimmune diseases, accidents, and musculoskeletal injuries. As a coping mechanism, nurses may begin smoking, drinking, and reducing their physical activity. This, in turn, leads to additional physical and psychological problems.
Evidence suggests that nurses also have a higher risk of committing suicide related to job stress. We have identified several barriers that must be overcome in order to avoid stress and stress-related health issues in the nursing profession.
The first barrier to overcome is a heavy workload on nurses. Nurses, in many facilities, have to care for more patients than they are comfortable with. A heavy workload can negatively impact the patient's holistic care. Nurses feel that they do not have enough time to tend to all of their patients' physical and emotional needs. In addition, many nurses have to do non-nursing jobs that could be accomplished by ancillary staff. Many nurses work through their breaks, and/or stay beyond their scheduled shift, in order to accomplish all of their job duties.
The second barrier to overcome is the exhaustive effect of long, 12-hour work shifts. Some nurses may feel burned out by the end of their shift. Fatigue increases stress levels, and can lead to an increase in clinical mistakes. Reliance on caffeine products to maintain energy for long periods of time causes a sustained stimulation of the sympathetic nervous system. This can have adverse effects on the nurse's performance and health.
Conflict is the third barrier to overcome in order to maintain a low-stress environment at work. Conflict can occur between nurses and physicians, among nurses, and between nurses and unlicensed personnel. Conflict results in decreased teamwork and efficiency, decreased job satisfaction, and an increase in sympathetic nervous system response.
Inadequate preparation is the fourth barrier we need to overcome. New graduate nurses have extensive classroom knowledge, but lack real-world experience. Due to inadequate staffing at many facilities, new nurses often get very little orientation time.
The final barrier we must overcome in our battle against stress-related health issues relates to end-of-life care. Because nurses are often with patients when they take their last breaths, it is important for the nurse to learn to cope with death. Nurses are expected to be able to give emotional support for the patient and family.
Barrier 1. Reducing the workload on nurses.
Decreasing the patient-to-nurse ratio can dramatically reduce the burden on nurses. There are two approaches that should be used to accomplish this task. 1. Hiring and training additional nurses. And 2. Retaining existing, experienced nurses through workplace incentives such as raises, benefits, and the implementation of stress-reducing measures. Implementing additional unlicensed assistive personnel can be a more cost-effective measure to decrease the burden on nurses. These measures will give the nurse more time to spend caring for each of their patients' needs, thus reducing the nurse's stress level.
Barrier 2. Reducing stress related to 12-hour-long work days.
Some nurses would benefit from the standard 8-hour workday. There is a trend in many hospitals to accommodate this by offering 8-hour shifts. For those nurses who remain on a 12-hour shift, it is beneficial to allow for scheduled breaks. A single half-hour break is inadequate for 12 hours of work.
Because nurses are unable to schedule 15-minute breaks every few hours, like other industries, it is recommended that nurses take on 1-hour lunch break.
This gives the nurse time to unwind and regain strength before returning to patient care. Accommodating longer lunch breaks may require a flex or relief nurse to be on duty for 4 hours during the middle of the 12-hour shift.
Barrier 3. Reducing conflict among healthcare professionals.
Team building workshops and training sessions have proven to be beneficial in building a better teamwork environment. This is an opportunity for workers to interact with each other in a low-stress and enjoyable environment. There are many companies that specialize in team building, with a myriad of offerings to choose from. Your hospital or department can come up with team building exercises of its own, as well.
Barrier 4. Inadequate preparation of new graduate nurses.
Preceptorship is the ultimate clinical experience in the nursing students' studies. It is recommended that nursing students engage in one-on-one preceptorship for the final 2 semesters of school, doubling the students' intensive clinical experience. Some hospitals have an extensive residency program to support the new graduate nurse for their first year on the job. This is a valuable resource for the new graduate.
Barrier 5. Emotional stress and end-of-life care.
Student nurses require preparation for dealing with death. Grief counseling should be available to all nurses, especially those inexperienced with death and palliative care. Studies show that having a network of supportive relationships outside of the workplace can positively contribute to mental and emotional health. These relationships could come in the form of friends and family, support groups, or even colleagues. Encourage the maintenance of a strong social support system.
Maintenance of a healthy diet and moderate exercise has proven to decrease stress levels significantly.
Nurses can do this by bringing healthy snacks and lunch to work, instead of eating cafeteria food. A 30-minute walk after work is an easily attainable goal that can allow the nurse time to reflect on the day and decompress. Setting aside a little bit of time every day, just for themselves, has also yielded many health benefits, including an increase in self-esteem and positivity. Engaging in regular, Healthy stress management techniques can reduce the nurse's likelihood of acquiring a stress-related illness. Coping mechanisms, such as smoking, drinking, and a reduction in physical activity, should be avoided completely.
Teamwork helps build trusting relationships and establish camaraderie.
If nurses are more open to helping each other on the job, workplace satisfaction can increase significantly. By working together, tasks can get done quicker and more efficiently, which decreases stress on an individual nurse. In addition, the improved camaraderie that occurs when the nurse builds relationships with co-workers through teamwork reduces stress and increases satisfaction. For the new nurse, making oneself available to assist the more established nurses is the first step towards gaining acceptance and increasing the likelihood that help will be available when the new nurse needs it.
Establishing the routine can help the nurse manage time wisely.
Though no two nursing shifts will ever be exactly the same, establishing a loose work routine has been shown to decrease stress. Humans are creatures of habit, and having a daily routine established can help nurses to stay on track and make their hectic workload seem more manageable. Establishing a routine can even give the efficient nurse a chance to schedule a break or two.
Nurses should be proactive by advocating for themselves and for each other.
Joining associations, such as NANDA, and the American Nurses Association, allow the nurse to actively affect the changing course of the nursing profession. NANDA's goal is to define the nursing profession through the establishment of diagnoses and terminology. By doing this, NANDA helps define the role and importance of the nursing profession. The ANA works to influence policy and legislation at the state and federal level. The ANA advocates for the RN as a leadership role in the healthcare field. Both of these organizations are powered by, and advocate for, nurses and the nursing profession. These, and many other national and local organizations, have a vested interest in decreasing stress and job turnover in the nursing profession. Being involved and proactive in the changing healthcare environment is a great way to increase confidence, build relationships, and decrease stress.